Tēnā koutou katoa, ko Katie Latimer tōku inua. Kia ora everyone, I'm Katie Latimer, I'm the Deputy CE here at Pinnacle.
My name is Joe Scott-Jones, I'm the Clinical Director for Pinnacle. I'm so proud and excited really to be working for Pinnacle with the opportunity that it provides for us to make really significant changes, not just for our practices, the communities they serve, but also for the wider community of general practice at large.
Kia ora, I'm Justin and I'm the CEO at Pinnacle. As 2025 starts to draw to a close, I thought it was a good opportunity just to share some of the highlights, the challenges and some key messages as we head into 2026. We know that general practice does over 20 million consultations a year. Over 95% of all touches with the health system happen within general practice. One of the things I think we're most proud of across the network has been the resilience that our practices have continued to show. They've had to deal with difficulty getting patients into secondary care and getting specialist services. They've also had to contend with increasing complexity, funding, and all of the other issues that make running general practice quite a remarkable feat. We saw this year one of the largest investments into capitation in general practice that we've seen since the establishment of capitation.
Pinnacle gives us an opportunity to have a really significant voice at those negotiation tables around what's going to happen with capitation, what's going to happen with the data, the governance and the data that we're sharing. It's important to be part of an organisation that has a trusted place within the system, because that trusted place means that we have a more significant influence over what the structures look like into the future. Not just with the government, but also with the college, with our Te Whatu Ora colleagues, and with the Ministry of Health.
So while we know there's been challenges, there's also been a lot of renewed interest in general practice, both politically and nationally. We've seen the New Zealand Graduate School of Medicine finally announced, which will be focusing on training general practitioners into rural communities. We've also seen expanded roles for nurse practitioners and scopes for nurse prescribing continue to increase. When we look a little bit closer to what Pinnacle has done, we've been working alongside those key providers, advocating strongly around the PSAP table for general practice funding, working with the university on the establishment. We've also had our extended care teams providing some great outcomes via shared care with our GPs for some of those most complex patients.
Our extended care teams have been providing services, access to people in Taranaki, Taupo and Tairāwhiti. We have contracts with school-based health services and outreach immunisation in the Waikato, which are being really effective. Our smoking cessation team has got a fantastic reputation nationally for achieving great outcomes.
Actually, the cost of doing business is really significant for all general practices. It doesn't matter whether you're a big practice, small practice, urban or rural. And so we've really doubled down on thinking about how can we support practices to reduce the cost of doing business, but also just to think about how we can enable some of the business operations. What comes to mind for me is claims, the practice portal that we've launched really recently. It's a real privilege to be part of a team that supports general practices day in, day out. And I know that they're absolutely committed to listening to your pain points. One of the other things that we did this year was we launched our recruitment and immigration service, and we know that we don't want to get into the business of immigration. That's not our core business. But what we did do was we partnered with New Zealand Shores, and it's been great to be able to bring that initiative to life. Additionally, we've got an initiative that we're looking forward to launching early in the new year around consumables and discounted consumables for the Pinnacle network. So another example of, while it might not be direct funding to practices, we're able to use our scale and size to support general practices with some of those extra costs that seem to be escalating at the moment.
Sticking with the closer to home theme, one of the announcements that Pinnacle's made this year that we're particularly proud of is the establishment of the Pinnacle Foundation. So from 1 July next year, we will be taking a large proportion of the profits or surpluses that those profit for purpose entities generate, and we will be putting them into a charitable foundation where practices will be able to use that funding to support themselves and the communities that they serve. So for this year, the aim is to distribute in excess of $1 million out to the network. And our aim and our aspirations are to continue to grow this where we can make a real meaningful impact for our general practice network.
Next year is going to bring even more work for us, unfortunately, than last year did, both as Pinnacle as an organisation, but I think also for practices. We're going to see changes in the way that prescriptions are managed, changes in simple things like ADHD services and the challenges that that's going to come, not just for those practices that take on board that service, but also the implications that has for the rest of us who aren't providing that service directly, but still have to manage those patients. It's going to be a challenge with measles, which is not going to go away. Our own focus will continue with immunisation. We know that practices are doing pretty much everything that they possibly can. So we need to continue exploring what more can we do, both as practices and as a support organisation, with our partners, to make a real difference. Our nursing colleagues, there's going to be more opportunities for us to expand nursing and what nursing can do. The regulation of physician associates is going to bring more of those people into our country. We're going to have our own training programs once regulation is in place, and that's going to be an opportunity for us. And there's the expanded number of medical students, the rise of the postgraduate medical school through Waikato, the number of people that are going to be opting into general practice training because we now have equivalence for the support, particularly for the GPAP 2s and 3s, in the financial commitment that they make to learning how to be GPs. As 2025 finishes and 2026 begins, I would just really like to thank practices for the work that they're doing in their communities. I'm proud of what Pinnacle does working alongside practices to achieve that. It is going to be challenging 2026, but personally I'm really looking forward to those challenges. I'd like to wish people a happy Christmas.
We also need to make sure that we rest and that we spend time with the people that we love and that are important to us, and the people that often help us along the journey as well. 2026 is shaping up to be a really exciting year, and we just need to make sure that we go in refreshed and renewed and optimistic about the future.
Thanks for turning up every day and serving your communities. Thanks for trying new ways of working, and thanks for sticking it out even when the going gets tough. General practice is at the heart of the health system, and Pinnacle's really proud of its role walking alongside you. So have a great year, and we look forward to talking in 2026. So from everyone here at Pinnacle, happy holidays.
Happy holidays.